So I first want to say a couple of quick things because Mr. Bernstein said that I could. I first want to say that a lot of you have healthcare professionals in your life, and I know they've been working very hard in the past year. So today I am one healthcare professional that will talk to you about my perspective. But on behalf of all of us as healthcare workers, I really want to acknowledge the huge sacrifice kids have made this year to keep everybody else safe. So you all have made a lot of sacrifices in this really difficult year. We see you, we know, we're grateful because every time you do that, every time you wear your mask and do all these things we're all kind of getting a little tired of, whenever you do that, you're keeping people in your communities safe. So we all thank you. I also want to thank Gordon School as both a parent that's been there for over a decade and as a pediatrician for the way you really thoughtfully and safely let our kids do things that kids want to do and need to do to be kids. That is being in school as much as possible and doing the things that kids do. And I think that every adult in that school, you all should really be grateful. Big shout out, big Zoom shout out for all of your teachers, administrators, leaders, people that take care of the school's facilities, nurses. All of those people have worked super hard to make sure that this year hasn't been as difficult as it has been for other kids who haven't been as lucky to be in school with their friends and their teachers. And then the last thing I want to say, and then I will let you guys take it over, is that I really love the COVID vaccine and talking about it because I think it's a beautiful marriage of basic science, so laboratory science, epidemiology science, which is sort of figuring out like cause and effect of diseases, statistics, so math, so pay very close attention in math class today because one day you could use those powers to really help make the world a better place. So when we talk about the vaccine, before we delve into some of the details, I really want us to think about the fact that this took incredible teamwork from a lot of people all over the world to bring this to bear. And I think we're very lucky that we're living in a world, a modern world, where we could actually bring a vaccine and have it go from a new disease that we never even heard about to a highly effective vaccine, almost like no other, in less than a year or so.
Thank you, Dr. Friedman. I want to highlight something you said before I turn it over to our student interviewer. You know, I really appreciate you pointing out all the sacrifices the kids are making this year in order to keep other people healthy. And that goes for the kids who are on campus wearing masks, social distancing. And it also really goes for the kids who are learning at home, who are, you know, often keeping someone in their family safe and have been learning at home, you know, all school year. So every member of our community has done a really, the kids should really be commended for that. We have a student interviewer, Simran Trivedi, is going to interview you today. She's got some questions prepared. Simran, take it away.
Hello, Dr. Friedman.
Hello.
My first question for you is, how does the vaccine make people immune to the coronavirus? How does it work?
So that's a great question. I like to think about vaccines as teachers. So vaccines teach your body how to react or respond if you came across the real virus. So if you give an example of some of the more simple vaccines we have, like that all of you guys have had growing up. For example, you might give a very small piece, a protein piece of that, call it a pathogen, bacteria or virus. You put it in your arm, and your body then says, oh, I don't like that guy. I don't know that guy. He's not supposed to be in my body. And your body learns how to fight that little piece of whatever that invader is. So your body then is prepared if you happen to come across whatever that disease is, or virus or bacteria. When you see it or are exposed to it for the first time, now your body's ready. Your body's like, I know you, and now my immune system is geared up and prepared to fight it. It's almost like people that had COVID have the terrible experience of having the disease. Probably their bodies are geared up. The next time they saw the virus or were exposed to it, their body would be pretty ready to fight it. But the beauty of a vaccine is that we teach your body that same response or one very close to it without having anyone have to get sick. So I like to think of vaccine as a teacher of your body in terms of what things that it doesn't really want there, it doesn't look like your own body, and how to be ready to fight it in case you do get exposed to it.
Oh, okay. Okay, so how is the vaccine tested ethically to make sure it's safe for people?
That's a really great question, because you always want to make sure that people that are participating in a trial like that, or testing of whether it's a vaccine or a drug, that they really understand the risks to them, the potential benefits to them. They're really motivated to do this, partly because they know that it will advance science, which is why we always tell people that's one of the big reasons why you're doing this. It's a little bit of a sacrifice, but that they also feel like they understand the risk to that, and they feel like that sacrifice is worth it. So you can imagine that in a lot of communities where English may not be your first language, that can be hard. But I got the sense reading the studies that they did from Pfizer and Moderna that they worked very hard. And we have a lot of rules. I do a lot of these kinds of studies at my hospital. And when we work overseas, the rule is I have to make sure that it's translated into a language people understand. They have time for questions. It's at a reading level that almost any adult could understand. And so those are some of the ways we protect people and make sure that they know what they're doing and they want to participate. Is that perfect? Probably not, honestly. But that's how those are what we call the safeguards to make sure that that's done ethically. The other issue around ethics is sort of access to these trials. So making sure that we have people from a broad range of backgrounds that can participate, because if many people see that as an opportunity, good for me, maybe half the chance I get something that's really going to protect me and my family. So there's that opportunity. And then there's also the piece that if you get to participate, if you finish that trial and it works and you happen to get the placebo group, you may also get the active vaccine. So there are a lot of benefits to participating. So you want to make sure that many different communities have access to that opportunity. And it also helps us learn how different groups of people may react to that vaccine differently. So you want to make sure you have people from lots of different communities, lots of different age groups, lots of different genders. So you really want to make sure that everybody that's included can give you a good sense of how well the vaccine works and how safe it is in all those groups.
Okay. You mentioned the placebo. Why is a placebo necessary when testing a vaccine?
So placebo is always hard for people to get. And the way I like to explain, because it feels wrong, like you're going to this study, you got all the work, they're drawing your blood, you get this thing in your arm, there's nothing there that's gonna really help you. A placebo is really, really, really important though. And I'll tell you why. When you randomize people, you have an equal number of people in the placebo group and the vaccine group. And the truth is that things happen to everyone in their lives, right? You may be in that placebo group and walk out, and 2 days later, you get very sick with a high fever and you don't feel good, right?
Yeah.
And so then we need to know, how often does that happen in the placebo group? That's what you call the baseline level of those side effects. And then we look at the vaccine group and we say, let's make sure that there's not a huge difference in those two groups, because the only thing different between those two groups, if we've randomized well, meaning all those people in those groups should really look a lot alike, the only different thing is that vaccine or not. So it allows you to blame or allocate those side effects to the vaccine or not. It's also incredibly important when it comes to what we call efficacy, right? So if you want to know how well this vaccine works, unfortunately, in both groups, you need people to get COVID or not get COVID, right? That's why they needed 30,000 people and more in these trials, because you need a certain number of people, and we feel like a lot of people have COVID, and they do, but if 5 to 10% of people are getting it, right, during the study, and they pick people that they thought would be more likely to get it based on their jobs and things like that, you still need to have a large number of people get COVID So that in the end, you can say, wow, look at that. If you got that vaccine, only 3 or 4 of you in this whole time got COVID. But now let's look at that placebo group. And they're more like 95 people in the same period of time got it. And without that, I don't know whether maybe that COVID group just stayed in their house with their masks on. Sorry, the vaccine group, right? They stayed in their house, they had their masks on, they never went out, and they didn't get COVID because they never went outside. They were not exposed. So I need to know that with that vaccine, I was much safer because I was like that placebo group probably in all my activities and going out and doing all that. And now I can say the only difference between placebo and vaccine was that this group got the vaccine, and boy, they did not get a lot of COVID.
Okay, that makes a lot of sense. Okay, I have another question for you. This one I feel like there's been a little bit of confusion about. Will people who have already had COVID get the vaccine, and has it been tested on them, and do they react the same way to the vaccine?
That's a great question. So I know that the answer is yes, because a couple of pediatricians that I work with had COVID and got the vaccine. So absolutely, people that had COVID are still eligible. And we can talk about whether that's a good use of vaccine, since maybe those people are protected, and there's probably a lot of discussion you could have about that. But suffice to say, it was felt that if they were getting the vaccine this early, it was probably because they were a high-risk group. And maybe we don't really know as well how protected you are and for how long after you have COVID, after you actually experience COVID. So those people are eligible and got it. The people that I know, happen to know, that had COVID and got the vaccine have only had their first dose, but they were fine. They really were fine.
Okay.
You know from the trials that a few percent of people in the trial had already probably had COVID. And they know that because before they enrolled them, they looked at their blood, and about 2 to 3% of the people, maybe a little bit more in the other trial, had antibodies, had evidence that your body already saw COVID and learned how to fight it a little bit, probably because you had COVID. You hadn't gotten the vaccine yet. So the only way you could have had that immune response already in your body to COVID is that you had COVID. And maybe you didn't have a very significant case of it, so you didn't even know. So those, we know that many people, a fair number of people in the trial had already had COVID. So we know a little bit about their reaction to the vaccine, and it did not seem any more significantly difficult to take the vaccine than other people. We do know that the vaccine was difficult for people who in their life have had a very, very severe allergic reaction to things. So that we learned a little bit more when we start to give the vaccine to more people. The hard thing about a vaccine trial is that often you take healthy people, you actually make sure you don't have people that have had very bad allergic reactions. You say, maybe we shouldn't have you in this first group that we really test this vaccine. So they didn't know that. And then they rolled out the vaccine in England. And part of the really great thing about what we can do these days is you're giving the vaccine now to millions of people, and we can make sure we follow those people and know about anything bad that happens to them now that we're looking in millions of people. And that's what happened with the allergic reactions. And now if you happen to be one of those people and you need a vaccine, you get that vaccine and you do it in a very safe space where if anything goes wrong, there are people there to help take care of it.
Okay. Okay. One last question from me, and then we'll open it up to the students. My question is, what do you have to say to people who are scared to get the vaccine?
Yeah, I understand that. I think that there are two big reasons, or there are probably more, but the two big ones I hear that we can talk about are it's going to hurt, right? And nobody likes to get vaccines. I get it. It's not fun. It hurts a little bit. I would say that I was so overjoyed and elated and really grateful the first shot that I got for COVID that I truly don't even remember it, and I can't even tell you about it. And many people say that. It doesn't feel much different. When the second one I was thinking a little more. It feels almost like any of the vaccines you all have had. Many of you have had flu vaccine. To me, it hurt a little bit less than the flu vaccine. My arm was sore for a couple days, to be honest. But other than that, that was the whole show. And I would do it again in a heartbeat. People that I work with that had the second dose and felt a little bit maybe not great the second day, maybe had some broader muscle aches and pains, maybe a little fever. They said they also didn't care and would do it again. They were so grateful to just be vaccinated. So I would say that about the sort of not so fun to get it. In terms of the safety piece, I really feel confident that looking at 30,000 people who got the vaccine. So across the two big studies that we talk about in the vaccines we're giving here, 30,000 people actually got the vaccine. The other 30 or 40 got placebo or got basically nothing in their arm. So we know a lot, actually. That's a lot of people. And people are concerned that it went too fast and we rushed it. But the speed of doing something, what's really more important in terms of understanding safety and how well something works is how many people you give it to. This vaccine was unique in that the rollout of the trial was incredibly large, all over the country, all over the world, actually. So even though it went quickly, you should feel reassured that it still was given to enough people to really know that it worked and that by and large, it is very, very safe. When we come to other issues like giving it to kids, right now there are lots of studies going on where they're gonna start to look at whether kids are at all different in the way they respond to this. Do they have more side effects? I suspect less side effects. So we'll know in a few months, actually. We'll definitely know a little bit more about the side effects. And hopefully we'll also learn that it works just as well to protect kids. And one thing also to say is that, you got, as we mentioned in the beginning, a lot of the work that you guys do to keep everyone else safe, the vaccine will start to do that for you. So on some level, even if you guys can't get a vaccine until maybe summer, a little bit later, I think a lot of the pressure will be off a lot of us in terms of keeping those vulnerable populations safe, because a huge percentage of them will be vaccinated. And the other thing is, as you get more and more people vaccinated, that virus kind of doesn't have as many people to jump to.
Right.
So if you have a little virus that's maybe in a group of people at work, maybe half of them have already been vaccinated, maybe now only one or two of them get it and bring it home and then spread it all over the place. So you'll probably start to see people think in March or April, the rates of COVID start to go down as more and more people are protected. So really, the good news is help is on the way. It's been a terrible year. I know it has been. And you guys have done a great job, but I really am super optimistic that your lives will be much, much more like normal when we come to next summer and next year.
Thank you. I want to thank Simran. How about a round of applause for Simran, please, for being our guest host. Great job. And I want to thank you, Dr. Friedman, for taking time out. I know you're really busy, but to help us better understand the vaccine and hear from someone who's had it, and to give us something to look forward to. I've never looked forward to a shot more than I'm looking forward to this one. So thank you very much, everybody else. I know we're hoping to take some student questions, and we got a big day of school ahead, and I want to make sure you have time for your class today. So we're going to say goodbye. Thank you very much. You can unmute yourselves if you'd like.
I can.
Yay, thank you.